Every 40 seconds, an individual in the United States undergoes a heart attack. Isn't that surprising? A stealthy adversary that strikes without warning, leaving devastation in its wake. Heart attacks and strokes rarely arrive unannounced. Instead, they send out premonitions, a month-long symphony of whispers that we must learn to heed. Recognizing subtle cues such as chest pain, heart palpitations, shortness of breath, arm discomfort, and jaw pain is crucial. Recent developments in medical science emphasize understanding gender-specific differences in symptoms. What's a heart attack? A heart attack, medically known as myocardial infarction, unfolds when the flow of oxygen-rich blood to a section of the heart muscle becomes blocked. This blockage, if not swiftly resolved, leads to an injury or death of the heart muscle cells. At its essence, a heart attack is a circulation problem stemming from a failure in the cardiovascular system to provide the heart with the vital oxygen and nutrients it requires to function effectively. The heart, a robust yet sensitive organ, relies on a continuous supply of blood through the coronary arteries to sustain its rhythmic and forceful contractions. When the supply is compromised or cut off, the consequences are immediate and potentially devastating. The severity of a heart attack can vary greatly, affecting a small or large area of the heart, and its impact is contingent upon how quickly the affected individual receives treatment. Understanding this medical emergency's basic nature is foundational, equipping us with the knowledge to identify early warning signs and respond with the urgency that heart attacks demand. Why does this occur? At the core of a heart attack's genesis is coronary artery disease, CAD, a condition characterized by the narrowing and hardening of the arteries that supply the heart itself with blood. This process, insidious in its development, is largely driven by the accumulation of cholesterol, fatty substances, calcium, and other elements, which together form a substance known as plaque. Over time, these deposits can reduce the flow of oxygen-rich blood to the heart, which is fundamental for its robust functioning. In some cases, the plaque may rupture, triggering the formation of a blood clot. This clot acts as a blockade, further restricting or completely halting the flow of blood to parts of the heart muscle. Without immediate intervention to restore blood flow, the affected heart tissue begins to suffer from a lack of oxygen, a condition known as ischemia, which can lead to the death of heart muscle cells. The progression from coronary artery disease to a heart attack underscores a critical point: the interplay between lifestyle choices, genetic predisposition, and environmental factors in influencing the health of our arteries. It highlights why understanding the underlying mechanisms of heart attacks is pivotal, not just for recognizing the emergent signs, but also for engaging in preventive practices that can mitigate the risk of coronary artery disease, thereby safeguarding the heart's vitality and function. Signs and symptoms of heart attack. The symptoms of a heart attack can manifest in a multitude of ways, some subtle and others unmistakable. Commonly, individuals might experience a profound chest pain or discomfort that feels like an unwelcome pressure, squeezing, or fullness in the center of the chest. This sensation can persist for several minutes, or it may dissipate and then return with renewed intensity. Additionally, discomfort in other areas of the upper body is a significant sign, including pain or unease in one or both arms, the back, neck, jaw, or stomach. Shortness of breath can occur, often accompanying chest discomfort, but it can also arise before any chest sensation is felt. Other potential indicators include breaking out in a cold sweat, nausea, or lightheadedness. Importantly, symptoms can vary between men and women, with women more likely to experience shortness of breath, nausea/vomiting, and back or jaw pain. Prevention of heart attack. Embarking on the journey of heart health prevention is akin to steering your ship through uncharted yet manageable waters. At its core, prevention pivots to embracing a lifestyle that champions cardiovascular well-being. This entails engaging in regular physical activity, which not only strengthens the heart, but also improves the efficiency of the body's oxygen use. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains forms the cornerstone of heart disease prevention, aiming to reduce the intake of saturated fats, cholesterol, and trans fats that contribute to artery blockage. Equally important is the management of stress, a silent but potent factor in heart health. Strategies like meditation, deep breathing exercises, and mindfulness can mitigate stress's impact on the heart. Regular health screenings play a pivotal role, enabling early detection and management of conditions like high blood pressure, cholesterol levels, and diabetes, which are stealthy adversaries in the context of heart health. In essence, prevention is not merely about dodging disease, it's about investing in a lifestyle that uplifts and safeguards your heart's vitality, ensuring that every beat propels you toward a healthier, more vibrant existence. If you're finding value in this video, don't forget to hit that thumbs up button. And if you want to see more amazing content like this, go ahead and smash that subscribe button. We've got plenty more coming your way. What is a stroke? A stroke, often referred to as a brain attack, occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from receiving oxygen and nutrients. Brain cells begin to die within minutes. This can happen in two main ways: through an ischemic stroke, which accounts for about 87% of all cases and is caused by a blockage in an artery leading to the brain, or through a hemorrhagic stroke, resulting from a blood vessel in the brain bursting and leading to bleeding within or around the brain. The consequences of a stroke can be devastating, potentially affecting motor skills, speech, and cognitive abilities, depending on the area of the brain impacted and the extent of the damage. Recognizing the urgency of this condition is crucial for minimizing its effects through timely medical intervention. Immediate action can significantly enhance the chances of recovery by ensuring swift, targeted treatment aimed at restoring blood flow in the case of ischemic stroke or controlling the bleeding and reducing pressure on the brain in hemorrhagic strokes. Why does a stroke occur? The genesis of a stroke lies in the disruption of blood flow to the brain, a phenomenon primarily driven by two distinct mechanisms. The more prevalent cause, ischemic stroke, emerges from blockages within the arteries. These blockages are often the result of thrombosis or embolism, where blood clots form or are carried to the brain's arteries, obstructing the vital flow of oxygen and nutrients. Alternatively, a hemorrhagic stroke unfolds due to blood vessels in the brain rupturing, leading to bleeding that compromises brain function. This rupture can stem from conditions like hypertension or aneurysms, which weaken vessel walls over time. These causal pathways illuminate the intricate balance required to maintain cerebral circulation. Factors such as high blood pressure, atrial fibrillation, diabetes, and lifestyle choices like smoking and excessive alcohol consumption significantly elevate stroke risk by influencing the health and integrity of blood vessels. Thus, the occurrence of a stroke is a stark reminder of the delicate harmony necessary for brain health, spotlighting the profound impact of vascular integrity on our overall well-being. Signs and symptoms of stroke. Recognizing the symptoms of a stroke swiftly is akin to setting a timer for survival and recovery. One of the most straightforward methods to remember these symptoms is through the acronym FAST: face drooping, arm weakness, speech difficulties, and time to call emergency services. A person experiencing a stroke might notice one side of their face is drooping or feels numb, with a possible inability to smile evenly. Arm weakness or numbness can make raising both arms evenly a challenge, often causing one arm to drift onward. Speech might become slurred or strange, making simple sentences hard to articulate or understand. Beyond FAST, other symptoms may include sudden confusion, trouble seeing in one or both eyes, severe headache with no known cause, or difficulty walking, dizziness, loss of balance, or lack of coordination. These symptoms demand immediate attention as the window for effective treatment is critically narrow. Swift action can make a monumental difference in mitigating long-term effects and maximizing the potential for a positive outcome. Prevention of stroke. Preventing a stroke involves a multifaceted approach that intertwines lifestyle modifications with proactive health management. Key to the strategy is maintaining a balanced diet rich in fruits, vegetables, and whole grains aimed at reducing blood pressure and cholesterol levels, thus diminishing one of the primary stroke risks. Regular physical activity, tailored to one's abilities and preferences, bolsters heart and brain health, enhancing blood flow and vascular integrity. For individuals who smoke, cessation is paramount. Smoking not only damages blood vessel walls but also increases clot formation. Limiting alcohol intake can further reduce the risk, as excessive consumption is linked to higher blood pressure and potential atrial fibrillation, a known stroke risk factor. Beyond lifestyle choices, managing pre-existing health conditions plays a critical role. Regular checkups allow for the monitoring and control of blood pressure, cholesterol, and diabetes, preventing these conditions from escalating into more significant threats. Lastly, for those with a history of stroke or transient ischemic attacks, Consulting with a healthcare provider about aspirin or other medication regimens could be a preventative measure worth considering. Engaging in these practices doesn't just guard against stroke. It fosters an overall healthier, more vibrant life. Risk factors of heart attack and stroke. The risk factors for stroke and heart attack often intertwine, painting a picture of how closely our heart and brain health are connected. At the forefront are lifestyle factors such as smoking, which damages the lining of the arteries, and poor diet, contributing to artery-clogging plaque buildup. Physical inactivity and obesity further escalate the risk by straining the heart and arteries. High blood pressure or hypertension acts as a silent threat, weakening arteries over time and making them prone to blockage or rupture. Diabetes, by affecting the artery's ability to manage blood sugar, can lead to harmful plaque accumulation. Additionally, certain genetic predispositions and conditions like atrial fibrillation introduce a higher likelihood of clot formation, directly linking to the onset of these medical emergencies. Cholesterol levels also play a pivotal role. High levels of LDL, bad cholesterol, contribute to plaque buildup, while low levels of HDL, good cholesterol, fail to remove LDL from the arteries. Understanding these risk factors is not just about recognizing the dangers, but about empowering ourselves to make changes that foster a heart-healthy and stroke-resistant lifestyle. That's all for today's video. I hope you found it informative and enjoyable. If you're interested in diving deeper into your health, be sure to check out our next video, 5 Best Fruits for Kidney Cleansing, Heal and Detox Fast. It's packed with valuable insights to boost your well-being.